Good evening, my dear students, OET aspirants. Welcome to our 47th live presentation on this virtual platform. It's me, Abhilash Vijay Mohan Nair from B-GHUD Academy. I've got Mr. Vipin and Mr. Jiren with me for accompanying this task. Okay, so I express our heartfelt thanks and gratitude to you guys for supporting us and making this session possible. Okay, there is a question discussion. So far, no concerns have been put in front of me by any of our students. This question was sent to us by Kishore. Okay, Kishore from Bangalore. So let's go for discussing the question. Okay, so it will be displayed right over there on the screen. You can have a look onto that, and we'll go for our discussion. Setting is a community health center. Okay, so you can have that question over there. Read that. I'm going to discuss that one. I'm going to explain the question. You can have a look onto that and we'll go for discussion. Fine. Any sort of queries, concerns, or any questions you have means do support me by putting it on the comment box. In your suggestions in the comment box, I'll be greatly obliged to help you all. Okay, so that is how you can support us. Any sort of suggestions you have means please do support us. Critical appraisals are more welcome. Okay, fine. Yes. Community health center is the setting. Yes. You can have the question on the screen. Okay. Community health center. It is the place where the role play takes place. You see a 66-year-old patient who is concerned about varicose vein on left leg, which have become increasingly itchy. He would like some advice. You have just examined leg, confirm inflammation of varicose vein, find out relevant details, patient details like general health, underlying health conditions. Okay, find out more details about symptoms. Find out more details about symptoms like onset, intensity of itching, any swelling, feeling of heat, etc. So we need to find out all these symptoms, whether the patient is experiencing any other symptoms associated manifestations. Do confirm it with the patient. Fine. Next one is like explain venous stasis dermatitis is the reason for itchiness. We can suggest a diagnosis. We can suppose the diagnosis as venous stasis dermatitis. That's a complex medical term. So you need to explain it in simple terms. See, it is given in the bracket like chronic inflammatory skin disease, building up of blood in damaged blood vessels, eventually leaking or oozing of blood into skin. So this is how you need to simplify what actually is venous stasis dermatitis. For a common man, lay person, common folk, it is very hard to understand what is venous stasis dermatitis, VSD. Fine. Find out any remedies tried. We need to confirm whether they have tried some remedies like medicated creams, lotions, moisturizing lotions, or something. Find out whether they have tried or whether they have undergone any remedies. Make recommendations to ease itchiness. How to ease itchiness? Suggest them some measures like moisture, at least twice a day moisturizing should be done. Thick emollients can be used. That should be without fragrance or dye. Compression stockings. All these things we can suggest our client to come out of this itchiness, to ease itchiness, to relieve itchiness. Fine. Emphasize importance of node scratching. So it would be very highly itchy and the patient would be keeping on scratching the area. We need to stress the importance of node scratching. Ask them not to scratch the area because what is that? It may again worsen the itching. The itching may get aggravated if they keep on scratching. Next is like it may lead to cuts and infection. Obviously, that cooling of blood swelling happens if they scratch means that eventually leads to cuts, burns, bruises, cuts, bruises, or and it may lead to an infection. Fine. Advice need for doctor appointment if symptoms get worse. So we can suggest all these remedials, but in case if the symptoms persist or worsen, we can ask them to get consulted by a doctor. Fine. Remind patient of varicose vein management and self-care. So finally, we can just give some supportive complementary measures by which by which they can manage the situation, like keep active, use loose clothing, avoid standing, sitting, prolonged sitting, standing, elevate legs when sitting. All these measures we can try. We can suggest them as a complementary or supportive measure. Okay. Hope you're getting me. Yes, my dear students. Any queries, any concerns means you can just uh, let me know. Yes, any queries? I hope the question is clear to all my dear students. Yes, so these all are exam topics. We'll be having detailed discussion. You can just see all these models. You can see the dialogues, observe the dialogues, the way by which I go for having these dialogues, the way by which I dictate these dialogues, the intonation, everything, the punch, everything you should notice and try to have a natural speaking. Okay, never go for by hurting or mugging up the things because it will sound monotonous. This speaking is it should be it should be there. Okay, high and ups and downs in voice is what intonation is. Okay, highs and lows. So you need to express the dialogues in a very natural way so that it will be more mellifluous and will be avoided with good score. Even you can fetch an A band if you use good intonation and if your dialogues are safe. Okay, fine. Any doubts, any queries means please do let me know. I think there are so far no queries have been appeared on the screen. So now let us go for discussion. This is a known case because it is set like you have finished the examination. You have finished the examination. So there is no need for any good afternoon, good morning or mutual introduction. The case is already in front of us. We have finished examination and we will start the dialogue from completion of examination. You need to confirm the inflammation of varicose vein. That should be the initial part of our conversation. Okay, never go for any beginning hangamas and all. No, that is not at all needed. Just finished examination means you need to confirm. We need to start from our findings. Okay, that would be brilliant. So this is a non-case. There is no doubt about it. Okay, so the patient is a varicose vein complaint. It has become highly itchy. So they are here to seek some advice, and we are going to help them. Okay. So how we can start this topic? An introduction, a better introduction, a best introduction. How can we give that? No need of good morning, good afternoon at all. So we can start the topic like, and yes, Martin, Mr. Martin. Okay, Mr. Martin, yes, the assessment is over. Mr. Martin, yes, the assessment is over. And the examination is over, the observation is over. Yes, Mr. Martin. Now you may please feel comfortable. The observation is over. The observation is over. Any discomforts? Discomforts. So they will be saying like, oh no, nothing is there. I'm doing well. All right, based on our consultation. All right, based on our consultation, I could see the inflammation of varicose vein. All right, based on our consultation, I could confirm the presence of varicose veins. Yes, the inflammation of varicose veins are there. Right. We are just supporting the statement. We are just starting with our assessment findings. Okay. Well, I need to ask you a few more questions. May I? Well, I need to ask you a few more questions. May I? So they'll be asking like, okay, now so you can ask me, how was your general health? Okay, how was your general health? Do you have any ongoing illness? How is your general health? Do you have any ongoing illness? Any lifestyle disorders? I mean, diabetes, mellitus, hypertension? Okay. Are you on any regular medications? One by one, we are asking this question. So they will be giving answers to each of this question. Never ask all together. One by one, we need to ask the question. Okay. So general health. Do you have any ongoing illness? Any lifestyle disorders? I mean, diabetes, mellitus, hypertension. Are you on any regular medications? So this is how we need to ask the questions one by one. They will be giving you answers. Okay. When did the symptoms start? When did you notice this itching? Like, when did you notice itching? Like, when did the symptoms start? Please tell me more about your symptoms. Now, please tell me more about your symptoms. When did it start? Like, when did the itching start? Okay. Okay. When did the symptoms start? When did it start? Fine. Uh, does it itch a lot? Does it itch a lot? Okay, like, does it itch severely or does it itch a lot? How or how severe is the itching? You can ask the intensity of itching. Okay. Did you notice any swelling? Did you notice any swelling? Did you notice any swelling? Do you feel burning or do you feel burning, soaring sensation over the skin? Do you feel burning or soaring sensation or a sense of heat over the skin? Do you feel heat or burning or soaring sensation over your skin? So they will be giving you answers to all these questions. Okay. One by one, we are asking this question, and the patient will be responding to all these questions. Okay. 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 See, we are asking about itching. Does it itch a lot? Did you notice any swelling? Okay. Do you do you feel burning, sorting, or sense of heat over the skin? So one by one, we have just complete all our questioning. Okay, see the question structure and how we are displaying the dialogues. Okay, so this is how we need to ask the question, and they will be reporting their complaints. Accordingly. Fine. I hope everything is clear so far. So, thank you for answering me. So they'll be giving you all the answers. Thank you for answering me. Okay, so the patient will be giving you all. Thank you for answering me. Uh, okay, thank you for answering me. Well, your condition is said to be, your condition is said to be venous stasis dermatitis. Well, your condition is said to be venous stasis dermatitis. Don't be anxious. It's a chronic it's a chronic inflammatory skin condition. It's a chronic inflammatory skin condition in varicose vein. It is a chronic inflammatory skin condition in varicose vein. This can happen because of pooling of blood. This can happen because of pooling of blood in damaged blood vessels. This can happen because of pooling of blood in damaged vessels. Okay. Eventually, it may lead. Eventually this blade, or it may leak or ooze into the skin. Eventually, it may leak or ooze into the skin. You don't have to worry. You don't have to worry. These are treatable. It is manageable. You don't have to worry. This is treatable. It is manageable. Either of the terms you can use. Okay, they would be very anxious, but we are just specifyingly addressing their concerns, explaining the reasons. Fine. Okay, so um, have you tried any remedies? Have you tried any treatment or remedials? I mean, some medicated creams or moisturizing lotions. Okay, I mean, some medicated creams or moisturizing lotions. Have you tried some remedials? I mean, medicated creams or moisturizing lotions. So they will be giving you answers according to that. Okay. Uh, they will be saying like some more. Was that effective? We can ask like if they have tried some treatment, we need to confirm like was it effective? How effective it was? And was it effective? Okay, so that is why the patient would be reacting to you. Fine. Yes. Now I could suggest you some recommendation. Now I could suggest you some ways. So now I have got some suggestions. Now I could suggest you some ways. Like I have got certain recommendations for you. Yes. Now I have some recommendations for you. Yes. Now I have some recommendations for you. Okay. It is indeed very important to continue the moisturizing. Okay, it is indeed very important to continue moisturizing skin. Okay, at least twice a day. At least twice a day, you can use moisturizing lotions. At least twice a day, you can use moisturizing lotions or emollients. It should be thick. Okay, it should be thick and material should be free of dyes and fragrance. It should be thick and the material should be free of, and the material should be free of dyes and fragrance. These are stimulants or that can trigger itching. These are stimulants that can trigger itching. Okay, it may hypersensitize your skin. Okay, these are stimulants that can trigger itching. So try to use emollient solutions twice a day. That should be without dyes of fragrance. Are you getting me? Are you getting me? And I strongly suggest you use compression stockings. And I strongly suggest you to use compression stockings. These are best effective way by which you can manage the situation. These are best effective ways which you can manage the situation. You're clear. You're getting me. Hope you're following. You follow. Okay, whatever it is. So the patient would be saying like, "Oh, nurse, I'll try." And regarding scratching, the patient is saying like, I know, it is really frustrating. I know it's really frustrating. This itching, I know it's itching. It's disturbing you a lot. It's frustrating. I understand. I strongly request. Okay, now it is my strong request you to not to scratch the area. Okay, I strongly request you not to scratch the area. You can say like, I understand, I know this itching, it's hurting quite a bit. I know this itching, it's has hurting quite a bit. It's frustrating. But please do avoid scratching the area. But please do avoid scratching the area. But please do avoid scratching the area. It may again aggravate, or it may worsen itching, or it may aggravate. It may worsen the situation. It may worsen the situation, or it may worsen itching, or it may aggravate itching again. Okay, this is not going to give you any relief. Moreover, frequent scratching or rubbing of the area can result in cuts, abrasions. Okay, cuts, bruises, or abrasions. Frequent scratching or itching, or frequent scratching or rubbing over the air, rubbing the area. Frequent scratching or rubbing over the area. The skin may it may result in skin injury. It may result in skin cuts. It may result in cuts, injuries, and bruises. Oh, eventually it may lead to infection. Eventually, it may further it can lead to infection. Further, it can lead to infection. Okay, it may result in some sort of complications. Healing could be very difficult in that case. Healing could be very difficult in that case. So make sure that you're not itching the area instead you're trying this complementary measures. Okay, okay. So the patient would be saying, like, definitely nurse, I'll try that. Okay. And in case if the symptoms persist or worsen, and in case if the symptoms persist or worsen, never delay, get a doctor appointment immediately. Get a doctor appointment immediately. Okay, now you can try all these measures and see what changes does it make. In case if the symptoms persist or worsen, never delay, get a doctor appointment immediately. They will later do the needful. They will do the needful. Understand? Understand. Okay, so the patient would be saying like, yes, nurse, I'm getting you. Do you have any other questions for me? Any other concerns? Is there anything else bothering you? So the patient will be saying like, no, no, what else? Yes, there are some complementary measures. There are some supportive ways by which you can manage the situation. There are some complementary measures, supportive measures by which you can manage the situation. Okay, you can practice these activities. Make sure that you keep yourself as active as you can. Make sure that you keep yourself as active as you can. Okay, sure that make sure that make sure that you keep yourself as active as you can. Okay, you can do some stretching, strengthening, flexion extension exercises, simple gentle exercises instead of strenuous vigorous activities. Okay, okay, keep active. Okay, so this may help in blood flow, easy blood flow. It eases blood flow. Okay, it relieves itching and swelling, all of the sensations that hurts you a lot. Okay, keep loose clothings. Okay, it promotes air circulation and promotes blood return. Okay, and keep loose clothing. Never go for tight packings or tight fixes. Okay, avoid tight fixes. Instead, you can use loose clothings that will promote air circulation. It relieves itching and other terrible discomforts, itching, sweating, and all. Okay, and avoid prolonged standing and sitting. So these are major risk factors cause varicose vein. Okay, make sure that you avoid prolonged standing and sitting. And whenever you sleep, whenever you are sleeping or sitting, try to elevate your legs. And whenever you are sleeping or sitting, try to elevate your legs. This facilitates venous return. This facilitates venous return. These are some ways by which you can keep yourself footable. These are some ways by which you can keep yourself footable. Right. It will do a great help. Right. It will do a great help. Right? It will do a great help. Try it. It will do a great help. So the patient will be saying like, sure, nurse, I'll try that. Is there anything else that I could Is there anything else that I could help? Hope your concerns all are assuaged. I think you're more informed. Will you be able to manage the situation by self? I'm sure you can do best. I'm sure you can do best. You'll be definitely relief from the symptoms. You'll be definitely having a relief from symptoms. The patient will be saying like, okay, nurse, thank you. Thank you for the visit. Take care. Thank you for the visit. Take care. Thank you for the visit. Take care. So by that, we are finishing the role play. I hope this question and this discussion was okay for you all. Yes. So our 47th live session at another important topic. It is over. So go through this, read this, listen this, practice by self, focus on intonation. Okay, sentence structure, how to slip from one task to task, slips and slides. Can never make them know that you are acting. Instead, it should be enough flow, a natural way of presentation. Do that. But practice. The more you practice, more mellifluous will be your speaking. So wish you all good luck. Stay tuned for our 48th live session next Friday. Till then, take care. God bless you all. Bye.